Good evening and welcome back to this special edition of Nye County. We're having a special edition because we're in the middle of a crisis that's going on, and so we decided to do something to keep you informed, to let you know exactly what's going on. And the most important person that I could have as my guest would be Chief Scott Lewis. Now, Chief Lewis, I call him Chief Lewis, and I have been calling him that for many, many years as a dear friend. But at the same time, he's also the Director of Emergency Management for Nye County. So for that reason, he's also a director. So maybe we should call him Director Lewis instead of Chief Lewis. But I like Chief Lewis, and we'll probably mix it up. So I hope you get used to me calling him Chief Lewis or Director Lewis, and we'll go with that. So I'd like to, Chief, welcome to the program.
Good evening, Dr. Waters. How are you? And thank you, and feel free to call me Scott.
Okay, I'll feel free to call you Scott, Chief. And this time, what I'd like to do is I'd like to go ahead and start off by thanking everybody. We have this situation going on with the coronavirus, and it is a very serious situation. We're going to have Chief Lewis is going to explain a lot to us throughout the evening. And again, if you'd like to take notes, I know you hear a lot of this over and over and over, but we'd like to let you know that there's so many people that we need to thank, because even while we're going through this, they're going through a lot of it as well. We want to thank those doctors and nurses and technicians that are doing things. Because I have a doctor's appointment coming up that we're going to do by telehealth, but I had to have a blood test. So that technician is there to draw the blood to make sure that everything is still going. So we need to thank all those technicians, whether it's x-ray or whatever. We have our first responders. First responders we're always thanking, but they need to be thanked each and every day. And not only them, but their staff as well. And when we talk about the sheriff's deputies, all the people that works in the sheriff's department, those people are there. But let's not forget the fact that there are times when, we haven't stocked up on 2 or 3 months worth of food and other things, but every now and then we'd like some fast food. Those people are at work. So we'd like to thank them for being there for us. There are things we may need for an emergency. Those stores are open. The drugstores are open. So the people are there for us. How do we get the people from point A to point B? We have the bus drivers, taxi drivers. So we have them that are working for us. We talk about essential employees, and I think the government is saying that. Everybody is essential in a particular way. And we want to thank each and every one of you for doing all you can to get us through this new normal that we're going through. But this, primarily, I just want to say thanks to all of you. Everybody that's watching plays a particular part in what we're going through and helping us get through this situation. Now I want to turn it over to Director Lewis, Scott, and he's got a lot of information for us.
Thank you, Dr. Waters. I also want to expound on what you just stated on the thanks. The number of people who are working behind the scenes to ensure our successes when we're trying to deal with this ongoing event has been just astronomical. We've had so many people extend donations to the respective agencies, whether it be through the Sheriff's Office, Prompt Fire Rescue, Department of Emergency Management. We've had the mines contributing valuable PPE. We've had food products delivered. We're using DEM as a distribution point. So no matter if it's a FedEx or a UPS products, everything's coming to DEM so we can minimize the exposure to our employees and to ensure that we have the accountability and the appropriate distribution methodology to get those materials out. So with that in mind, that also considers all the PPE, whether it's coming in, and personal protective equipment is what PPE is. But despite where its origination is, whether it's FEMA received from the state or through local donations, all that is coming through the Department of Emergency Management. It's being inventoried, it's being documented, and then it's being distributed to the appropriate personnel throughout the county. So no matter if you're in a small town, less than several hundred people in Nye County, you still have all that personal protective equipment in order for you to be able to complete your missions. And I think one of the very first and foremost pieces for us to consider is your county government is still operating. We're doing it differently. And quite frankly, that difference is what's making the bigger charge in how we can make sure that not only our employee but our citizens are properly protected. This is a very unique circumstance that we're experiencing, and we are commonly referring to it within our organizations as a marathon versus a sprint. So this is not something that's going to be done overnight. It's something to be taken quite serious. We hope that our messaging is out there, but our county government is operational. And as I had mentioned just a few minutes ago, that we are doing it from remote locations. We are not operating in a normal fashion. We have our incident command post, which is established at the Emergency Operations Center. Typically, that type of scenario would have all the leaders in one large area that would be able to communicate immediately and be able to share under a unified fashion information, dissemination, and decision-making. But because of the social distancing aspects of this and the requirements for us to maintain, our EOC and the ICP is a matter of just a few people. And those few people are all under the same separation distance requirements. So how are we doing this? We're doing it remotely. Through our IT and Brad Adams and his group, he was able to connect everybody, or nearly everyone, through different means so we can have our teleconferencing. We can have video conferencing. We have the abilities to do the instant messaging and emails and texting, all those things from home. So it gives us that greater latitude to ensure the safety of our community while still maintaining county business. You may have known that recently we had two Board of County Commissioners meetings. That was a Herculean effort in order to be able to set that up. So through IT and Samantha Tackett and a lot of others who were instrumental, such as Commissioner Koenig and Tim Sutton, our town manager, or county manager, excuse me, they were able to get those pieces of the puzzle in place to ensure that the community and our citizens had the ability to participate in their government. And that's worked out quite well. And that's something that we're going to continue, and we're going to bolster it as much as we possibly can. As I mentioned, this is not a sprint, it is a marathon, so we are preparing for worst case scenarios. I would ask that our community consider that everything we talk about is fact-based. We're not making decisions based on opinions, innuendos, or speculation. The only way that we can make true, wise decisions is based on statistics, what we're experiencing out in the field, and the facts of the situation. Our key components to this are our messaging, stay at home for Nevada, stay at home for Nye, and stay informed. Now, when we say stay informed, that's not the easiest thing to do in this current situation. So through our public information officer, Arnold Knightley, the sheriff's office with Captain Baruchwitz and the sheriff, and also our IT, we were able to conduct and actually put into place different messaging opportunities, such as under NyeCounty.net is a website that you can go to for the most current information that pertains to Nye County. There are regular distribution of materials on that website, and it's valuable, so please keep that in mind. If you don't have the opportunity or don't have access to the internet, a hotline's also been established, which is the COVID hotline, and that is at 775-751-4333. That is a voice-prompted telephone response, and it also is offered in both English and Spanish. So there are two ways that you can get instant information as we speak at any point in 24 hours a day.
Chief, would you give that number again, please?
Absolutely. It's 775-751-4333. And that is the COVID hotline telephone number. So through our public information officer and through the sheriff's office, we have utilized different venues and different media in order to get our messaging out. And that's under the communication portion of our plan. So when we do that, we put it out on stationary display boards, mobile display boards, social media, in written print. We're doing it on the internet, as we discussed on the website you just mentioned, but we're also putting out daily text and tweets. And some of the things that we've received favorable feedback on is the grocery stores. So Captain Baruchwitz and several others were recognizing that food products and paper products were being received at different facilities on different days. So by utilizing social media, we were able to get the message out early on as to who has what products. So if you're in absence of paper products, for example, you can go on that daily site, see what store has it at that hour, and you can go make the purchase. We also noticed that our senior citizens and our special needs individuals who reside in town were having challenges in getting their product because they're a little bit slower moving maybe that they're confined to wheelchairs or other devices to get around. So we had worked with collectively through the grocery managers as a grocery leadership committee, met with them and formulated alternating days at specific hours that were designed and designated specifically for use by our senior citizens, special needs individuals that can go in there and get their products and be out that same day. One of the things that we're working very closely on is what's called a COOP plan, and that's C-O-O-P, and that's a continuity of operations plan. So a continuity operations plan is basically multi-levels and multi-tiers as to how we're going to maintain certain levels of government. When we look at it from a leadership standpoint, as a fire chief, if something were to happen to me, I would have to have people in place and mechanisms in place to ensure that the fire department continued running. So in normal cases, we would have at least 2 layers. In this particular case, because of the widespread in what we're experiencing across the country, we've gone up to 3 and 4 levels deep, not only on the leadership, but also on the staff, facilities, apparatus, and equipment. So if anything became contaminated or was taken out of service for whatever reason related to COVID, that we had alternate means to still provide that service. That is a very, very important component, and it has been gone through as far as the dissemination throughout the county. So each of the key positions with the county also has that COOP plan, and we've identified alternate sites in order to complete our business. The COOP plan also includes the leadership within the other agencies, whether they be volunteer groups or administration on the highest levels of the county. So no matter where you are within the county, the COOP plan would consider the absence of their facilities, that they could be moved to another alternate location, whether it's through communications, that we can still maintain the same high level of response and reaction time that we are normally accustomed to in normal operations. So when we talk about the stay at home for Nevada, that is probably one of the most important and most successful pieces of this endeavor is the socialization distancing. That has helped us the most in keeping this at bay. We are fortunate here in Nye County that we're kind of spread out over 400 square miles approximately in Pahrump, but Nye County in general has further separation distances, so that allows us to maintain that.
And we're gonna finish this in the next session. Welcome back. We're so glad to have you back with us. Again, we have Chief Scott Lewis, who is also Director Scott Lewis for Emergency Management. He's the Director of Emergency Management. And you can understand why I asked him to be our guest. He's our guest because I had some other people scheduled for today. And this is before we knew exactly what was going to be going on with the coronavirus crisis. They were from out of town, and of course they couldn't travel. And so I called Chief Lewis and asked him if he would step in for them. He's replacing 2 people, but very easily. It takes about 10 people to replace him. But when he stepped up, I knew that for this special edition of Nye County, we would have very important information for each of you. I also want to let you know that we're honoring all the things that we're supposed to do for safety. We're doing the safe distancing. We do have our masks available, and we put those on. We're taking them off just so you can see us and actually understand what we're saying. But we do have our mask available. We're practicing all the safety things that we're asking you to do. The safe distancing, the wearing of the mask, and all the things that we're advising you to do to stay safe, stay home, and stay safe. Again, my guest, and I want to turn it back over to him because he's got so much information that we need to get to you so that you know what to do, how to do it, when to do it, and we want you to stay safe. So back to Scott Lewis and let him tell us some more things about what we need to do during this crisis.
Thank you, Dr. Waters. So as a part of the component in our discussion today, I ask that you display the Nevada statistical data, please, for the audience to see. Every day we produce a COVID situational report within DEM, and that is distributed to our leadership group. That gives us the ability to understand where we are, provides that snapshot of information that we discussed in the last segment. That also provides us the facts that we need in order to make some very serious decisions at all levels and how it's going to impact our overall operations. So when we look at the Nevada statistical data, it shows that out of all of the people tested, which is 20,566, 2,318 have tested positive, and 18,248 have tested negative. That's a significant statistic that we need to keep in mind when we have our discussions, that not everyone is dying from COVID. However, those that have underlying medical issues or have other immune deficiencies are at risk, and we need to know who those people are. Out of the other statistics of those who tested positive, 80 folks have passed away in the state of Nevada, and that number continues to rise. That is a very serious number, and that is an indicator to us that even when we achieve the peak or the flatten out the curve, that we're still going to have that number continue to rise because of the number of people that remain in intensive care, and many of them on ventilators. So even though we may flatten up the number of people testing positive, does not mean that's automatically going to lower the curve, if you will, on those who pass away from COVID. So what does that mean for Nye County? Currently, Nye County has a total of 10 confirmed cases, 8 of which are active confirmed cases, and 2 have resolved or have recovered per the guidelines under CDC for the template under which they use for the guide, for the guide to determine whether or not somebody is recovered. And the majority of that, it comes down from if they're symptomatic and how long they've been asymptomatic, and then go through a checkoff list. That does not mean they haven't had another test, and it does not mean that someone's actually gone out and investigated them. It's simply the state contacting an epidemiologist, investigator, who will contact them, determine their current status, and then either return them as recovered to society and no longer having to quarantine. The majority of those that have tested positive are from Amargosa, Pahrump, and Tonopah. Now, the majority out of that particular group are from Pahrump. Tonopah had 1 case and Amargosa had 1 case. Also, the recovered was 1 out of Beatty and 1 out of Pahrump. So we're relatively low on the statistical scale, but we are not resting on our laurels on that number alone. We continue our efforts to test individuals, and as we speak, we have conducted approximately 369 tests throughout Nye County. The testing has been completed in Pahrump. There was 1 today in Amargosa, Beatty, and Tonopah, but we're having multiple rounds. So the second round, which started this past week, now considers, again, Pahrump. There's going to be an Amargosa, Beatty, Tonopah, and another testing site in Round Mountain. So by the end of this week, we will have offered those testing to all the large communities within Nye County and given the opportunity for the smaller towns to move to those testing sites. The testing sites I will go over momentarily, but when we talk about the overall components, so from a worldwide or a global perspective, we're at 1,503,900 confirmed cases and approximately 89,931 deaths. So the number of confirmed cases since this time yesterday has increased 50,000 or 53,557, and we've increased almost 6,400 deaths. In the U.S., we currently stand at 432,579, and then there were 14,830 deaths. So we've increased over 31,413 since this time yesterday, and we've increased almost 2,000 in deaths. These numbers are evolving. So even as we speak and provided those numbers, again, those numbers are a reference. They're not finite. They're continuing to increase every hour. Just about every 15 minutes, Johns Hopkins University is increasing or updating their charts and their lists that are available on site at johnshopkins.health, I believe it is. But if you go on that website, you can get the most up-to-date information as far as where the nature of the cases are and the numbers. The completed Nevada cases is a very, very important number because those numbers are most likely going to drop some now because we're having great difficulties getting the testing kits. The testing kits are changing, they're evolving as well. They used to take 5 to 7 days, then they were 3 to 5 days. There are some kits that are available out in the market that can take just several minutes. However, most of those kits are going to what we would consider hotspots throughout the county. If we could show the chart, please, for the hotspots in the country. So as you can see by referencing this chart, the larger the red circle, the hotter or the greater the confirmed cases, and that is the larger hotspots. And if you look at that closely, you'll see in Nevada, we're a significant number. We're over 2,000. So we're on an upper level. But the East Coast, when we consider New York City, Connecticut, Washington, D.C., Philadelphia, Baltimore, they're all new hotspots. Louisiana is New Orleans specifically is a hotspot. Florida is a hotspot. California, and where it all began was in Washington State, that continues to be a hotspot. The majority of the personal protective equipment, the PPE, is being distributed to those areas because that is where the majority of the cases are right now. And that's where the seriousness, when we listen to Governor Cuomo and some of the other governors speak, and Governor Sisolak, they've identified the need for ventilators to maintain the respiratory tract for humans that can no longer breathe on their own. And that's what this virus does. It attracts, or it actually attacks the respiratory tract and gives you pneumonia-type symptoms. So it's very, very important that they get that material over there because number one, they need the support. Number two, they need the PPE for the emergency responders and the care providers and the clinicians to make sure that all the patients are getting the appropriate treatment that they need. There had been a challenge in acquiring a lot of this because we're competing and bidding against each other to a certain degree. So the National Strategic Stockpile is now exhausted. And so what that means to us is that we simply cannot put in a resource request saying, I need 30,000 masks for Nye County. First of all, they wouldn't support that number because the number of people who have actually been confirmed positive here are 10. So statistically, that's not sound. It doesn't mean, though, at some point that we can have a more significant number, which is why we need to maintain our steadfast position on social distancing. But what it does also offer us is the ability to understand how things evolve so quickly. Because even with the low numbers that we're experiencing, that is how it started in most of these other large areas. So when we consider the distribution models, the National Strategic Stockpile being exhausted leaves the state stockpile, which has already been exhausted. Now, we had a stockpile on certain types of masks, N95 masks within Nye County, but as the state has informed us, is that to be extremely careful in the dissemination models because there are no backups to be had. And the majority of those masks in the early part of this event occurring in the United States, and when it finally arrived here in Washington, was that most of those masks were manufactured abroad and were not available to us because they were keeping them for themselves. So we had to be extremely careful on our distribution models to make sure that the appropriate people get PPE and that is used appropriately, and in many cases used repetitively using other techniques to ensure that they're as safe as possible. This is where our private partnerships with the mines and other folks who have donated those materials to us is so important because there are short and small stockpiles out there that when disseminated through DEM can then be distributed through the county based on necessity and the frequency of contact with patients with COVID-type symptoms. The majority of those symptoms, while have occurred in Pahrump, we've had those symptoms through other areas of the county and we've been addressing them accordingly. Quarantining through our health officer and through the sheriff's office and through DEM has been a challenge because there's the part where people are being suggested to quarantine from a testing purpose alone versus being symptomatic and confirmed COVID positive. Most people have been very cooperative in that spirit and have self-quarantined once they're instructed to. We've had some that we've had to pay a little bit more attention to make sure that they're following those guidelines, but in general terms, people are doing the right thing for the right reasons and following the guidelines. In those cases where we're in contact with them on a regular basis to ensure that they're not worsening, and if they do worsen, they're going to another appropriate level of care in order to be carefully monitored by whether it be a hospital in Nye County or if it goes to a hospital located in the Las Vegas Valley. Not all patients that are transported out of Pahrump or Nye County are COVID positive patients. They may have signs and symptoms, but the majority of those interfacility transfers are still occurring for people who have underlying medical reasons and medical necessities. Dr. Waters?
And now you can tell why I asked Director Scott Lewis, who is the Director of Emergency Management, to come and speak to you today. He's got a lot of information. We still have a lot to give you. So I'm hoping you're writing this down, especially the phone numbers, the contact numbers, the things you need to do. We want you to come back for the next sessions because we still have a lot of information to give you during this special program. Welcome back, and we're so glad to have that you're back with us. Again, I want to continue for each session, I want to let you know that my guest today is Chief Scott Lewis, who is also the Director of Nye County Emergency Management. He takes care of everything. When we look for any emergency situation, everybody turns to Scott Lewis. That's just what we've been doing for many years now. We trust him, we have faith in him, we have confidence in him. He's just an individual that, when you think about integrity, above reproach. That's the way I look at that. Another person that we have to look at is our governor, Governor Sisolak. One of the things that you hear over and over is maybe the governor is doing too much too fast. Others are saying, well, maybe not. And when we look at the map of the overall situation, which we had up earlier, to show the situations, how bad they are in the world, look at what's happening in Nevada. He took the action. I personally think that he took the right action at the right time. You don't wait until people are dying before you start actions. He did something so that we're not another New York. We're not another New Orleans. We're not another Washington State at this point because of the actions that our governor has taken. So I applaud him for his quick action, his guidance, and his leadership in the state of Nevada. We're doing great as far as surviving, but you still have to remember, as Chief Lewis said over and over, hey, it's a marathon. We're right at the beginning of this, and we want to get through it. We want to get through it together, and that's what it's all about: sticking together, following what the governor has put out, following what the county is putting out, to make sure that you stay safe. Stay safe, Nye County. Stay safe, Nevada. That's what it's all about. Let me turn it back to Chief Lewis. He's got a lot more information for us, and we want you to pay attention to everything that's said.
Thank you, Dr. Waters. If we could display the continent chart, just want to make a quick reference. So when you review the continent chart as shown on your screen, you can see that the majority of the cases are in Europe, in the United States, and Asia. So when we look at that, they were experiencing COVID long before us. So they were the template. And we were able to learn many lessons by what they had failed on and what they had succeeded on in trying to contain the virus. Many of the challenges came from attitudes of the individuals who didn't take COVID seriously and thought it was just another virus, much like influenza, that was easy to remedy. It was quick to go away, and quite frankly, could even be considered seasonal. That is not the case with this. We've been asked questions on the field testing. The field testing is essential to understand our baseline, where we are, so that we know what our successes are and how social distancing is either working for us or it's not. And in Governor Sisolak's message, he's recognized that early on through listening to the state DEM folks and state health folks, indicating that the best way, the absolute best way to avoid contracting COVID is staying away from others and secondarily using some form of protective device, such as a respiratory mask or wearing some other type of mask or bandana, something like that, to help minimize the distribution of those particulate matter that we normally expel during inhalation, talking, things like that, up to 6 to 10 feet. That is absolutely the best way, followed by washing of our hands, not touching our faces with unwashed hands, and keeping those types of materials away from our ingestion points. Most people don't realize that it also covers and includes your eyes. We want to avoid rubbing our eyes or placing anything near our eyes, kind of materials. We have a tendency just to have our normal habits, placing a pen to our mouth. And, it's all bad habits that we're all having to work on together. But when you look at what Governor Sisolak's message is that he recognizes that and he is continually reinforcing that. And in some cases, when he's finding through feedback received by other citizens, community groups, other federal and local enforcement agencies, that people were not adhering to it, it makes him to go to the next level to ensure everybody's safety. So what do those next levels look like for us? From DEM's perspective, it really creates several different key components that we're working on a daily basis. And so all of our thoughts, all of our decisions are based on these models. And that is preparedness, prevention, resources, response, and ultimately one of our biggest challenges is going to be recovery. So when we talk about our preparedness, what does that mean to us? It's ensuring that all of our EMS resources are available for response. They're available to manage patient care. It's also making sure that they have all the necessary personal protective equipment in order to complete their objectives and missions. That's a shared responsibility. And so when we know that someone may be symptomatic or has been tested and is symptomatic or even is COVID positive, we're asking for that detailed information so that we in turn can notify through our dispatchers, that address is flagged, so if there's any response, whether it be law enforcement, EMS, or fire, that we know to take extra precautions to ensure the safety of those responders, because they can't help anyone else if they in fact have become the victim. So there's things that you can do as well. If we have an EMS response to your house and you're not COVID positive, you're not symptomatic, you can still meet us at the curb if you're physically able to do so. So calling 911 if you're not feeling well, or you have a fall and you may have hurt yourself and have a laceration, control the bleeding, meet us outside the house. EMS will come and provide the necessary care and get you to the appropriate facility for your injuries or illness. The other things too, communications are so important. And this is the reason that we feel these forums are so extremely important, is to get the information out. We want to avoid all the unnecessary and incorrect information that's disseminated on a regular basis through social media. We've reviewed some of the information out there, incorrect statistics as far as who's been confirmed COVID positive, where they're located, and what's happening with them. 99% of that information is completely inaccurate and completely speculative with no basis whatsoever. So it's very important that we exercise effective communications, and that's something we strive to do. And I think our public information officer has done a really, really good job with that. So here's the other pieces. The other communication includes our internal and external. We also have to get those necessary communications out to all of our internal staff to know that, or for them to know how safe they are, what precautions are working, what they need to do to continue serving the community, and also where to get the PPE in those distribution points and what we're running low on. So our internal is considering teleconferencing, our emails, our instant messaging, text, mobile radios, portable radios, sat phones, Aries and Races group. Everyone has, the Aries and Races group. If everything else fails, those people are there to make sure there's another layer of support that we can contact with people in Carson City to get information and to get assistance if necessary. So again, multiple levels. That's all part of that COOP plan. We also talk about the external. That is very important to make sure that people have access to information 24 hours a day. We reference the website. We reference the COVID hotline number. There's public messaging. We're in regular contact with our school district, making sure that they get appropriate information as to how it pertains to our student population and our teachers. We're on social media. Captain Berukowitz from the Sheriff's Office and Arnold Knightley, our PIO, constantly on social media, getting and pumping that information out. Important information that people need to know in order to make decisions for themselves. TV, radio, print, we're doing PIAs. So that is very important to just the public information announcements, short clips, something to reinforce our messaging of social distancing and being prepared. The daily sit reports. They're out there to our leaderships to make sure everyone knows where we are. It gives a snapshot in time. We recognize this is an evolving event. We recognize there's changes. As soon as we print that report, it's already changed within several minutes. 15 minutes later, we're getting new information on increased numbers and such. But it does provide us that snapshot to understand where we're going within the curve. The mobile and the stationary display boards, almost all those folks in town that have access to an electronic display board has changed their messaging. Some of them couldn't because there's private vendors that manage those machines, or the display boards, and they have since closed down due to the governor's recommendation, so there is no one there to actually change or place the message up. The popular grocery messages for specific foods and paper products has been going great. We're continuing that effort. And again, the grocery store leadership teams have been just absolutely awesome. They're letting us know when they receive a particular stockpile of materials. They're also gathering things for the emergency responders to ensure that we have the appropriate PPE available to us. And when I also referencing grocery stores, it's also like our Home Depots and places like that. We have citizens who are coming up and found that they maybe have 5 to 10 masks that are still sealed that they purchased several years ago, and so they donate them to us. And we get those out to the public and into our hands of our response groups. Our facilities, we're ongoing field testing. So the field testing right now is in Amargosa. It's going to be in Beatty and Tonopah, and then it's going to be in Round Mountain on Friday. So I can go over that schedule in a few minutes, so we'll do it in the next segment. That way it gives everyone the opportunity to secure a pen and piece of paper throughout the county. It will give you exact dates, times, and locations for the field testing. We've identified facilities within the county that could serve as surge facilities. So in other words, if we get a significant increase of whether it's sick people, and in the worst case scenario, even if there's a mass fatality associated with anything, maybe not even related to COVID, we are prepared through plans to have those types of pieces of the puzzle in place. It's not to say that this is going to happen here, but again, it's part of our preparedness piece. We identify the facilities for establishing our mass fatality plans, as I mentioned, our surges in whether or not people are affected with COVID, and also care and treatment facilities. We've also identified possible isolation and quarantine sites. We also have in our plans for temporary structures, including MASH-type structures and triage areas, much like you're seeing that are being established in Clark County. We're identifying areas that we can best manage the homeless, making sure that we're not getting any reported cases within that population. And so we have processes in place to help address that. One of the things too, when we deal with it, is supplies, our personal protective equipment. As I mentioned several times through the course of today's show, is that we have strategic stockpiles both at the federal and state level. However, those have been depleted. So we're now relying on our Nye County supplies and also going into those private sectors. Dr. Waters?
Yes. You know, as we listen to Chief Lewis and he gives you all of this information, we want to make sure that you have information so that you're not relying on rumors or conspiracy theories. We want you to have the facts, and that's what we're presenting here for you today, the facts, so that you know what to do, when to do it, and how to do it. This is a worldwide pandemic, worldwide. We've looked at the map, we've shown you over and over exactly where we are, and we'll finalize this in our next session. Welcome back for our final session. I always hate for our sessions to end because we have so much invaluable information for you. And by having the Director of Emergency Management for Nye County here, Scott Lewis, we get all the information that we actually need. There's so many things that have happened, not only throughout the state of Nevada, but throughout Nye County. And some of us are just totally unaware of all the things that have happened. I said earlier during session 1 that we wanted to thank all the doctors and nurses and first responders, the sheriff's deputies, and all the people that are out there preparing food for us and working in drugstores and working in other places where we might have emergency situations. And of course, we need food. So the people are there and they're working to make things easier for us. So we want to say thanks to each and every one of them. And we want to say thanks to all of you because you're following the guidance that have been put out by the county and the state to stay safe and protect each other. So all these things are here. We're letting you know during this worldwide pandemic that we're here for you. That's why we're doing this show, to make sure that you know what's going on. We have a lot of information still to come, and Chief Lewis, Director of Emergency Management for Nye County, is here to tell us more about it.
Thank you, Dr. Waters. So we ended the last segment on discussing some of those supplies and resources and how they're being distributed. When the stockpiles are being released, again, it's referencing who has the most exposures, who have the most confirmed cases, and what are the severity levels of those confirmed cases. That's why we felt it prudent to show you some of the charts earlier in the segments to give you an idea of where they are and where it's traveling. So if we were to look at it and draw a nexus, the East Coast and the West Coast were the first primary areas to experience COVID. And as we went there, the tentacles started going to the other metropolitan areas along the East Coast in the states of Connecticut, Pennsylvania, New Jersey, and then also DC area, Baltimore, Maryland. So as they continue to spread, we're seeing those hotspots in the populated areas. So one of the considerations that we have is, as we talked about earlier, is trying to get those resources deployed to remote areas and rural areas such as Pahrump and Nye County to make sure that we were appropriately prepared. Now, we did have some stockpiles available for masks and such, and we still are just getting some of those materials distributed. But we have a realization that we don't have everything that we could conceivably need in the numbers that we would need if we had a serious outbreak here. So again, reinforcing the social distancing, because that is going to be the common thread that I'm going to refer to throughout the course of this program today, is social distancing. Please maintain it, take it seriously, it is paramount. But what are the resources that we're talking about? We're talking about the regular personal protective equipment, including the gloves, the N95 masks, which are different from the surgical masks. We're talking about the face shields and the gowns. We're talking about possible Tyvek suits, which are encapsulating suits, but it'll keep the face piece open that we could utilize other PPE for that. Eye protection, wearing special goggles and glasses, or the protective face pieces that have the two combined into one. We also have access to filter masks that we purchased at the very early stages. So we have the ability to use filtration in order to minimize our exposures for the emergency responders. The fire departments have self-contained breathing apparatus that allows us to breathe purified air in a cylinder attached to our backs. And we did have two different models that are available. We have Scott products and also mine safety appliances, which are also known as MSA. So we have a number of packs that are available through each of the fire departments in the worst case scenarios. We also have adopted resource requests, but most of these are being shipped again to those hotspots and not necessarily making it down to the local and to the rurals. We are working on that, and I know the state is working diligently to help us with that. We've been in contact with some very, very dedicated individuals at the state level through the Department of Emergency Management that have been working diligently to ensure that the rurals have the necessary equipment and are prepared in order to be able to complete the missions and complete the objectives that have been identified both on the local and the state levels. Our emergency response agencies, they're numerous, but just to mention, to reinforce, we have Pahrump Fire Rescue, we have Amargosa Fire, we have Beatty Fire EMS and Hazmat, we have Tonopah Fire and EMS, we have Round Mountain Fire EMS and Hazmat, we have Current Creek Duckwater, we have those folks that are out there with the fire responses. Gabbs has fire and EMS. We have Belmont, Manhattan, and all those different folks who are preparing to provide the necessary protection for their communities. With the Sheriff's Office, and through the Sheriff's Office you have not only the deputies, but the detectives and the administrative staff, but you also have large exposures through the detention centers, both in Tonopah and Pahrump. Then the PPE is going to these folks to make sure that they're protected and make sure the inmates are protected as well. We have the Sheriff's Auxiliary who's out with us, and I can tell you 24 hours a day assisting us on other emergencies and getting out there and helping the Sheriff's Office get necessary components of this underway. The search and rescue teams have been out there working through the Sheriff's Office, making sure businesses are complying and taking care of other issues that normal deputies would be responsible for, but frees them up for other assignments. We also have all of our individuals who are at Desiview and our clinicians and our physicians and nurse practitioners and all those individuals who are working diligently in town to make sure that all of our patients are safe and that everybody is operating and getting the information out as quick as possible. They're also assisting us in helping determine who is actually being tested and whether or not they're symptomatic, so then we can get them into our CAD system, which is a computer-aided dispatch, to red flag those addresses so again our emergency responders are protected. One of the things that we're doing and we're having to do remote is that I'm a part of a leadership operations group under FEMA support function ES4 it's a mouthful, I realize, of the Multi-Agency Coordination Center, which is called a MAC, out of the Clark County, Las Vegas area. All that means is very simple. There's multiple groups that are operating in a coordinated fashion to get information, to receive information, disseminate it, and make sure it's as accurate as possible. I'm one of the representatives for Nye County, and that my sole purpose and objective is to identify and communicate challenges for mitigating the COVID-related purposes that are here in Nye County. And so on a daily basis, we're providing information through the MAC, through the ESF4, and therefore everyone is on the same page to understand where we are. We're also in jurisdictional meetings on a daily basis, which goes directly to the state and goes from there, is filtered and goes directly to the governor's ear. So he has a complete understanding of what we're experiencing, whether it be exposure issues, receiving personal protective equipment, if we're having an anomaly on types of responses, and which we'll go into in a second. So that gives them the ability to understand where we are on the barometer of COVID. One of the things that a lot of people don't reference, but it's very, very important, we're in a new world. We're in a socially remote type of approach now. And so that's fostered challenges, especially with our seniors and our other people who are shut-ins. They look for outlets such as the senior center and having people visit them, and them having the ability to go out and do their grocery shopping as part of their socialization, as part of their normal daily routine. In many cases, that's been altered, and so they don't have those means to have that congregate socialization, even going to houses of worship, or even going out and just taking a stroll and with your friends and just having that time together. With those things in mind, we need to reinforce and to remember that we still have to keep these people in our mind and thoughts. Call them, talk to them on Skype, other social media forums, but make sure they're okay. Depression is something that can set in very quickly in these scenarios. We've seen an uptick on domestics, suicide-related issues, and there's things that we can do to help prevent those. We're working with Nye County Coalition on mental health and behavioral health issues that we can get the necessary information out to citizens to know that somebody's there for them, to know that they care. Department of Emergency Management has been steadfast in a position of not just recording statistics for the people who have been confirmed COVID, but to maintain in constant contact with them to ensure that they're doing okay, that they're either getting better, or if they're worsening, to make sure they know what their options are to get the appropriate level of care. It's very, very important to all of us that we simply take care of each other, but we're going to have to think outside the box. And I know that's an overused expression, but clearly in this case, it's appropriate. We're going to have to rethink every single thing we do. And as Dr. Fauci even said recently, that even something as simple as shaking hands or the warm embrace of another is something that may have to change for the foreseeable future. We're not accustomed to actually keeping our distance from people. It's natural for us to go up and say hello and shake hands and have those exchanges. That's who we are, but we're going to need to rethink that, do it differently for the overall good of our community. And one of the last things I want to address today is we've talked about preparedness, prevention, the resources, and the responses, but we also need to be thinking simultaneously on what the recovery looks like. So we have worked diligently at the leadership level within the county to make sure that we're taking the appropriate steps to help our county recover both financially, socialization-wise, and make sure our businesses and our school districts and our school district reopens and gets people back into their normalcy as much as possible. While that may not be overnight, we are taking the necessary steps to ensure that we're considering those steps, and also considering the monies and the covering of the expenses that would need to happen in order for us to get back to where we are and to improve and gain back our sense of normalcy. One of the first things we did under the direction of the Nye County Manager, Tim Sutton, and the Commissioner Chairman for the Board of County Commissioners, John Koenig, was declare an emergency. That created a stepping process, if you will, that allows us to draft a letter. And that letter was an intent to recover the expenses associated with our response to COVID. That's going to include any potential overtime issues, the purchase of personal protective equipment, anything else that may become necessary, the socialization issues, the sheltering in place, those types of things are all covered in there. Our finance section chief, Savannah Rucker has created a project code. That project code is specific to COVID, so any expenses that we incur, whether it's equipment or staffing, goes through that code, and that is overall will become part of our program and our process in order to try and recoup those expenses. So I know it's a lot of information in a short period of time. We're always available for your questions at the Department of Emergency Management or post them on social media, and we'll get back to you with the most accurate and factual information as possible. Dr. Waters?
How in the world can we thank Scott Lewis for all the information he's provided us today? It's phenomenal. All the steps that they've taken, not only throughout the state, but throughout the county to make sure that we're safe. I hope you've recorded a lot of this information. I hope you've written it down. I hope you've looked at the phone numbers that you need to call or anything else. And we'll see you next month with another program.